not just for kids. Adults need protection through vaccination as well. Did you know that complications from typical childhood disease can be even more severe in adults? Well, today on Healthy Connections, Dr. Raul Pino is here from the Florida Department of Health in Orange County to talk about vaccines, your best form of protection. So we know there is a schedule of vaccinations that most parents agree to take to get their child taken care of. Do you need to get revaccinated when you're an adult?
Sometimes you do. So
and how do you know which one?
So there are ways. You can ask your doctor to test for your titers. It will mean they will test what level of immunity you have for a specific disease.
Are there certain ones? I know tuberculosis.
For example, mumps is one that we recommend, that especially for younger population going into college should be tested for mumps, for the titers. And you can test for any titers. And if those titers are low...
Tell me what a titer is.
A titer is a measurement in the blood of the level of immunity that you have for that specific disease.
Okay. So are we seeing a rise in diseases that we thought were eradicated because of vaccinations? And which ones should we be on the lookout for? You mentioned mumps.
Yeah, so all the childhood disease, infectious disease are important, and those are the ones that are continually increasing the numbers around the world.
So we're talking about measles.
Measles, rubiola, sarampion, mumps, and chickenpox.
Okay.
So one of the issues has been the fact that it has been a movement of anti-vaccinations that has gained a force.
What is the thought behind, I'm not getting my child vaccinated because it causes more problems than it solves? Let's talk about that argument.
So many people also believe that it's the system, your body have the ability to produce immunity. Why am I immunizing you?
Okay.
If you are going to get exposed to, let's say, rubiola, you may get immunity. But what some people don't realize is that a percentage of the population, yes, you may develop immunity, but there's going to be a percentage that is going to suffer harder consequences because they were not vaccinated. What any vaccine does is to prime the immune system to quickly recognize the presence of that germ because it was already primed to recognize. So it's in your memory, it's in your immunity memory.
And then does that then allow your body to fight it?
That allows your body to react quickly.
Okay.
Because it knows that it's there.
Okay.
So it's an intruder in your body that you already been watching through a cam, and you are surveillance. You are watching it comes and you react quickly.
So for adults, because we're talking about how the symptoms of childhood diseases can be much worse in adults, what questions should you ask your doctor in terms of whether you should be revaccinated?
Do I need to be vaccinated? Will I like to know the titers and immunity level for a specific? But keep in consideration that we are living longer. And the longer that we live, that memory, that immunity memory that the system has decrease and decrease.
So are we talking about people who take care of children? Are we talking about grandparents, elderly people?
People with immune complex disease.
Okay.
People with HIV. And there are other vaccines that are giving in adults like pneumococcal and meningo. Encephalitis, those vaccines are provided at an older age.
What about pregnancy? Should pregnant women be vaccinated?
They should consult with the provider.
Okay.
Their general answer is yes, but it also depends on the conditions of the fetus and what their health is.
Any last words that you want to leave people? We talked about the anti-vaccine movement, and the studies connected to that and autism have been disproven, but people still believe it. So are there some parting words that you want to leave with people?
If we are living longer past 40 years old, like we were, 200 years ago, or maybe even shorter than that, it's because vaccines are here.
Okay.
If we are healthier, it's because vaccines are here.
So the bottom line is have a conversation with your healthcare provider and get the facts.
And make an informed decision.
Knowledge is power. Although measles were thought to be eradicated in the United States in 2000, the disease has reappeared due to non-vaccination rates. The best way to protect yourself and your family against vaccine-preventable diseases is by immunization. But call your healthcare provider or contact the Florida Department of Health's Orange County's immunization program for an appointment. The phone number is 407-858-1444. 407-858-1444. Do your homework, make an informed decision.